Hey, what's up guys? Today I'm gonna explain and show you what's the lumbar spinal stenosis and how to treat that. Alright, let's go along. Spinal stenosis occurs when the space inside the vertebra becomes too narrow. This puts greater pressure on the spinal cord and the nerves that run through it. Spinal stenosis most commonly occurs in the neck and lower back. There are rare cases spinal stenosis has no symptoms. The most other people may experience pain, tingling, numbness, and muscle weakness in the lower back, buttock, and both legs, and symptoms may worsen over time. The most common cause is degenerative wear and tear changes in the spine associated with arthritis, which may require surgery in severe case. Surgery can expand the space inside the spine around the spinal cord and create more space. This may relieve symptoms caused by pressure on the spinal cord or nerves. However, since arthritis cannot be treated with surgery, arthritis pain in the spine may continue. Spinal stenosis is often asymptomatic. Symptoms worsen over time, and symptoms appear differently depending on which part of the spine is affected. Spinal stenosis can cause pain or cramps in one or both legs, which may occur when standing or walking for long periods of time, but symptoms improve when bending forward or sitting. Usually happen the signs and symptoms as numbness, tingling or weakness in a leg, foot, or arm, hand, problems with working and balance, neck pain, problems with the bowel or bladder. The vertebrae are stacked in columns from the skull to the tailbone, and they protect the spinal cord, which flow through an opening called the spinal canal. Although some people develop problems because they are born with a small spinal canal, most cases of spinal stenosis occurs when the space within the spine narrows for a variety of structural reasons. The first reason is bone spurs. Wear and tear occurs where arthritis occurs in the spine, and that damage can cause additional unnecessary bone to grow in the spine, called bone spurs, which can grow inside in the spinal canal and narrow the space. Paget disease can also cause additional bone to grow in the spine. Second reason is a herniated disc. The disc is a soft cushion that acts as a shock absorber between vertebrae. If some of the soft jelly-like internal substance inside the disc leaks, it can put pressure on the spinal cord or nerves. The third reason is thick ligaments. Strong ligaments that have connected the upper and lower vertebra to each other can become stiff and thick over time due to external or internal forces or ligament damage. Thick ligaments can be pushed into the spinal canal, narrowing the internal space. The first reason is tumors. In rare cases, a tumor may form inside the spinal canal, narrowing the space inside the spinal canal. Fifth reason, spinal injuries. Other trauma such as car accident, industrial accident, assaults, and sports injuries can cause vertebra to break or move out of space. Also, immediately after back surgery, surrounding tissues may swell, putting pressure on the spinal cord or nerves. Spinal stenosis most often occurs in people over the age of 50, but younger people may be at higher risk if they have other spinal problems, such as scoliosis or a herniated disc. Your healthcare provider may ask questions about your symptoms and medical history and may require a physical exam or imaging test to help find the problem. X-ray. X-ray of the back may show changes in the bone that can make the space within the spinal canal smaller. Computerized tomography (CT). If an MRI scan is not possible because there is a metal object inserted in the body, a pacemaker, or an electronic device, a CT scan may be necessary. The test combines X-ray images taken from different angles to produce results, and CT myography, which can show disconation, bone spurs, and tumors involving injection of contrast dye to align the spinal cord and nerves. Magnetic resonance imaging (MRI). The MRI can detect damage to disc and ligaments and can also show the shape and location of tumors in detail. Non-steroidal anti-inflammatory drugs (NSAIDs). Prescription NSAIDs are effective when common painkillers do not provide sufficient relief. Anti-seizure drugs. The anti-seizure drugs gabapentin is used to reduce pain caused by damaged nerves. Antidepressant. To relieve chronic pain, take a tricyclic antidepressant such as amitriptyline nitrate. Opioid. Oxycodone and hydrocodone are powerful narcotic painkillers and should be prescribed in limited quantities because they can cause addiction or habit forming. Physical therapy. Improve your sense of balance, increase strength and endurance, maintain flexibility and stability of the spine. Because nerve roots can become irritated and swollen at the pinched area, injecting steroid medication into the space around the pinched nerve may help relieve pain by reducing inflammation and swelling. However, steroid injection may not be the best option for spinal stenosis, as some studies have shown that combining steroid with an anesthetic does not reduce back pain more effectively than an anesthetic alone. Because steroid can cause serious side effects, repeated steroid injections can weaken nearby bones, tendons, and ligaments, which can easily cause damage to normal or repetitive movements. So it's recommended to take them every few months. In some cases, the ligaments in the back of the lumbar spine may become too thick, and symptoms can be improved by removing part of the ligaments by inserting a needle-like instrument through the skin, which creates laminectomy. This surgery removes the back part of the affected vertebra. This creates more space around the nerve, leaving pressure on it. In some cases, the bone may need to be connected to a nearby vertebra using metal hardware, and bone grafts. Laminotomy. This surgery removes only part of the lamina and creates a hole just large enough to relieve pressure in the specific area where the pain is occurring. Laminoplasty. This surgery is performed only on the vertebra of the neck and creates a larger space within the spinal canal by creating hinges in the spinal plate with metal hardware connecting the gap in the opening of the spine. This surgery helps reduce spinal stenosis symptoms, but in some people, symptoms remain the same or worsen after surgery. Surgical risks include blood clot in leg veins, tearing of the membrane covering the spinal cord, epidemic. A brief explanation of lumbar spinal stenosis is here. Now, I'm going to show you the first level of therapeutic home exercise. Alright, let's go to love.
Our hearts beat to the city streets. We began to feel the fire. We rise like tall buildings as the chemicals they take us higher. The night's young and it's just begun as she puts her hand in mine. We wanna chase the night, wanna dance to the light, pull the stars from the sky, just two hearts running wild. Never sleep, never stop, as we shout from the top. We're gonna be two hearts running wild. Now the morning is the afternoon. We lay awake in bed. The laughs so loud as the hours pass. We're gonna do it all again. We wanna chase the night, wanna dance to the light, pull the stars from the sky, just two hearts running wild. Never sleep, never stop, as we shout from the top. We're gonna be, we're gonna be two hearts running wild. The moonlight, summer sky, it was the best we ever had. And we'll stay young forever. We'll never have regrets. We wanna chase the night, wanna dance to the light, pull the stars from the sky, just two hearts running wild. Never sleep, never stop, as we shout from the top. We're gonna be two hearts running wild. We're gonna be, we're gonna be two hearts running wild. Our hearts beat to the city streets. We began to feel the fire. tall buildings, as the chemicals they take us higher. The night's young, and it's just begun, as she puts her hand in mine. We wanna chase the night, wanna dance to the light, pull the stars from the sky, just two hearts running wild. Never sleep, never stop, as we shout from the top. We're gonna be two hearts running wild. Now the morning is the afternoon. We lay awake in bed. The laughs so loud as the hours pass. We're gonna do it all again. We wanna chase the night, wanna dance to the light, pull the stars from the sky, just two hearts running wild. Never sleep, never stop, as we shout from the top. We're gonna be, we're gonna be two hearts running wild. The moonlight, the summer sky, it was the best we ever had. And we'll stay young forever. We'll never have regrets. We wanna chase the night, wanna dance to the light, pull the stars from the sky, just two hearts running wild. Never sleep, never stop, as we shout from the top. We're gonna be two hearts running wild. We're gonna be, we're gonna be two hearts running wild.
Major therapeutic home exercise is here. Please do this therapeutic exercise once or twice a day, after get up in the morning or before you fall into sleep from Monday to Saturday. Please put the alarm on your cell phone at same time for regular home exercise. If your signs and symptoms are improved a week later, start the high level of therapeutic exercise. If not, keep it up the same or low level therapeutic exercise. Then, if signs and symptoms do not improve or pain worsen even after level 1 exercise, please see medical doctor as soon as possible and get an accurate diagnosis and test. Please watch the following video. Make sure you like the video, thumbs up, subscribe, and then turn on your ring notification. Have a beautiful day. See you again.